Hi everyone, I'm going to deliver a little bit exposure about Leptothrix. It was first described in 1843 by the German botanist and his name was Friedrich Cousin, the guy in the slide. And the name Leptothrix actually derives from the Greek words leptos, which means thin, and trix, which means hair, thus reflecting the appearance. The structure of Leptothrix is seen as filamentous, which means it has a thin structure resembling a thread. It is a non-pathogenic gram-positive organism and frequently noticed with coexistence of Trichomonas vaginalis infections. On the right side of the slide, the first picture is Leptothrix stained with gram stain procedure. Second and third pictures are Leptothrix observed under SEM, scanning electron microscope, and the last picture is the Leptothrix colonies. Like what we have learned in our lecture, trichomonas and leptothrix together have been referred to as spaghetti and meatballs, which will be explained further by my teammate.
Next is significant finding of leptotrix. First is low prevalence and symptomatic impact. Leptotrix are rarely appears to be the primary cause of vaginal symptoms. Only about 0.65% of women with vaginal symptoms attribute their symptom to the leptotrix. Second is leptotrix was associated with a higher risk of candidiasis, but lower risk of bacterial vaginosis and cytolytic vaginosis. Cytolytic vaginosis is a vaginal condition that involves overgrowth of lactobacilli bacteria. Third is safe nature and microbiome marker because leptotrix does not appear to be associated with adverse outcomes such as cervical intraepithelial neoplasia (CIN). Increased risk of CIN is a precursor to the cervical cancer. Next is demographic and risk factor because leptotrix was more commonly found in premenopausal women because of the hormonal factors. Leptotrix also showed a higher prevalence among women with HIV. Last but not least is a diagnostic and treatment implication.
Moving on to the morphology of Leptothrix, it is a non-pathogenic, gram-positive, non-spore-forming and anaerobic organism. It is a thin filamentous long bacteria, almost thread-like, and can exist in S or U shape. It may form lobes in conventional smear or clouds in liquid base. Leptothrids are commonly associated with the presence of Trichomonas infection. The morphology is referred as spaghetti and meatball. The spaghetti refer to the leptothrids and the meatball refer to the Trichomonas. It exists in 95% of cases in a pool of 1,000 cases. There are two strains of Leptothrix that can be found in vagina smear. The first one is Leptothrix vaginalis. It is commonly seen in vagina of young female, especially during pregnancy. And the second one, Leptothrix buccalis. But as the name gives it away, it can present more in oral microbiome, hence the name buccalis. One might ask how to differentiate between the flagella of Trichomonas and the Leptothrix. While the Leptothrix is longer and exists in background, meanwhile the flagella of Trichomonas attached to its body. These are the differences between leptothrids and other organisms that share the similar morphology. The first one is totaline bacilli. It belongs to the genus of Lactobacillus acidophilus and microaerophilic, compared to leptothrids that belong to the Lactobacillus and some older like Mestrobi claim it belongs to the Fusobacterium. Next is Monelia, or now known as Candida. It belongs to the fungi genus and the only one that forms spore in comparison. The total line bacilli is shorter than Leptothrix, which is 2 to 9 micron or 5 to 15 micron. Meanwhile, the Leptothrix is longer, thinner, and darker than total line bacilli, which has length between 45 to 70 or 40 to 75. Lastly is Monelia, which are longer than Leptothrix and segmented. Both total line bacilli and Candida can cause disease in humans. Now, observe the pictures below. Can you guess which is which? On the left side is a luteal phase with marked cytolysis. It contains abundant totalized bacilli. It also contains naked nuclei from the intermediate cells and cytoplasmic debris. On the right side is obviously a candida. Why? Because it is longer, thicker, branched, and septate.
Infection associated with leptothrix. Firstly is trichomoniasis. Leptothrix found in the vagina of young females during pregnancy. It occurs as a co-infection along with trichomonads. The finding of Leptothrix may give us the clue to the existing of Trichomonas vaginalis together. The infected individuals are more likely to acquire HIV. It also associated with adverse birth outcome. Those ones should be aware and have an emphasized care while reporting smears with trichomoniasis. Next is bacterial vaginosis. It characterized by a reduction in number of beneficial lactobacilli and overgrowth of a variable mixture of strictly anaerobic bacteria. As we know, Leptothrix is an aerobic bacteria, and it explains why it might present in bacterial vaginosis.
Now I will continue with the signs and symptoms. The most common symptoms are vulva burning, which is the main symptoms with 91.7% in this study, followed with abnormal discharge, thick yellowish discharge, which can be compared with the normal that should be clear whitish like egg white texture, and dyspareunia, pain during intercourse, vaginal itching, increase in the amount of discharge, and dysuria, pain during urination. All of these signs and symptoms reported with presence of Leptothrix where it can be the sole causes.
Treatments are very dependent on which organism it associates with, for example, Trichomonas vaginalis and bacterial vaginosis. The treatments aim to resolving the symptom, and if the patient is asymptomatic, there is no indication to treat them. As a result, the antibiotic prescribed is specially made for this organism. The recommended treatment for Trichomonas vaginalis is metronidazole. Typically, this drug is prescribed as a single dose of 2 grams orally or as 500 mg orally twice daily for 7 days. This treatment is very effective if taken correctly. Other than that, is clindamycin is usually prescribed at a dose of 300 mg orally twice daily for 7 days. The last one is sexual partner treatment. The patient must avoid sexual intercourse while they are being treated for trichomoniasis, as the patient may become reinfected. Tinidazole is also antibiotic that you can take as a pill. For BV, there are two recommended dosage. The first one, 2g orally per day for 2 days, and the second one, 1g orally once per day for 5 days. Clindamycin is another effective prescription treatment for BV, such as clindamycin cream, by taking it intravaginally daily at bedtime for 1 to 3 weeks. The last one is setnadazole. The recommended single dose is 2g. Patient can take the granules by mixing them with unsweetened applesauce or yogurt.
Summing up our presentation, Leptothrix is a non-pathogenic organism, an innocent bystander with a total prevalence of 2.8%. The age, ethnic, and geographical features of these females might affect the prevalence of Leptothrix. That's all from us. Thank you.